Terry. Nice to meet you.
Nice to meet you.
How'd you hear about our clinic?
On Facebook.
Oh, nice. Okay, perfect. Well, tell me a little bit about what brought you in or what concerns you have.
I have always had thick legs since I was a teenager, since early teens.
Okay.
Couldn't wear cowboy boots, and I rode horses, and just thought that was the way our family was built, that we had thick legs. And growing up, they'd get bigger and bigger, and now they're to the point where they're huge and difficult to manage, can't find clothes that fit, have pain, severe pain throughout my thigh, legs hurt constantly, and just tired of it.
Okay. And when was the first time you heard about lipedema?
Just a few weeks ago.
Okay. Somebody approached you or you were online?
I read a little bit about it prior, and then someone approached me, and she has lipedema, and she asked if I had ever heard of the diagnosis and handed me a pamphlet and said, I think you have it.
Okay, great. Well, I'm glad you're here.
Okay.
So I don't know if you looked on our website, but I've been working with patients who have lipedema for about 17 years. I was at the University of Washington with vascular surgery, and then I did a short rotation with plastic surgery, which is nice because a lot of times lipedema kind of falls in that vascular plastic surgery world. And then I would run the leg edema program. So if anyone came with large legs, heavy legs, aching, varicose veins, they would meet with me, and we would kind of figure out what's going on, what's the cause, and that's when I became really comfortable with lipedema. So then I decided to open this practice, and I see patients virtually and in office. I can only see patients virtually if they're in the state of Washington, but my goal is to educate providers and patients across the country so that if they don't have somebody they can see, they know what to take to their primary care doctor or what a visit will look like, okay? Mm-hmm. So in the interest of time, we're gonna follow the Clinician's Guide to Lipedema. It's a handout that was created by the Lipedema Foundation. So we'll start out with just asking some questions, then we'll do a physical exam, then I'll go over some treatment options, the plan of care, and then you can ask any questions, okay? Okay, perfect. So the Lipedema Foundation came out with a guide for patients to take to their primary care doctor to talk about whether or not they have lipedema. So there are some key indicators, but we'll start out with family history. So you acknowledge people in your family have a similar shape. Is that on your mom's side of the family or dad's side?
I believe my mom had it.
Okay.
Of course, we wouldn't have known that then,
Right.
but since I've learned about it, I looked back, she's passed now, but I looked back on pictures of her prior, and yeah, she did have typical signs of it, the big legs, thick, heavy, from the waist down mostly.
And you have daughter?
I have a daughter, yeah.
Does she have a similar shape?
Not as much, but I could see the possibility of her having it, because, we joke that it runs in the family.
Yeah.
The thick legs.
Okay. And how about difficulty losing fat in the affected areas? So I know you told me earlier the legs and kind of the upper arms. Mm-hmm. Have you had a period of time where you've lost a lot of weight?
I had gastric sleeve about 10 years ago, a little more, and lost over 80 pounds, but I never felt like my legs went down. And that was very frustrating because my waist went down significantly. And I did lose some weight in my legs, but not very much. So my waist, I could wear a probably size 12. But my legs, I had to get a 16 or an 18 or a 20 and then have this massive waist because my legs wouldn't go down.
Right.
And then, arms got a little bit smaller, but still were always really thick.
Okay. And then when did you notice the onset of your legs kind of feeling larger than your peers or your arms? Was it around any sort of hormone changes like puberty, pregnancy? Can you describe that?
Yeah, mostly puberty. Like I said, the cowboy boots, being equestrian and 4-H, all my friends could wear the cool pull-on cowboy boots, and I couldn't get them on, or I'd have to cut a slit in them to get them in there. Mm-hmm. Again, we just thought that's the way it was. Pregnancy, I don't really know that there was a significant amount of change. Looking back now, probably menopause. When I was perimenopause,
Yeah.
it probably got even worse.
And that was after your gastric sleeve or around the same time?
It was a few years after,
Okay.
actually, because that was, yeah, no, yeah, would have been fairly close.
Okay. Perimenopause can take about 10 years.
Yeah,
so it's
yeah.
kind of ongoing.
It was probably around 52,
Okay.
and I'm 58 now, so yeah, it would have been after the sleeve.
All right. How about pain or tenderness or heaviness in the legs or the arms?
Oh yeah.
Yeah? Tell me about that.
Well, my legs feel like they want to explode. My lower legs, my skin is so tight there, and as the swelling comes and goes, it just gets worse. My upper legs, I have severe cramping along the outside of my thigh. I have numbness. It doesn't make sense, but there's numbness and pain and hypersensitivity all in one, from my hip down to my knee. The numbness is kind of all in this area. There's electrical pulses. It feels like a TENS unit's attached to it and shooting electrical pulses throughout it sometimes. Sometimes it feels like there's somebody shoving their fist into my leg and twisting it and holding it there throughout the day. I mean, it's just it cycles through all of these things throughout the day, and it's getting worse and worse as time goes on.
How about the right leg? Do you have any sort of fatigue, pain?
The fatigue, yes. The pain, no, but I'm starting to feel a little bit of it.
Okay. And heaviness on both sides?
Oh, yeah.
They both feel heavy to you?
Oh, yeah, absolutely.
Okay. How about your arms? Do they ever get fatigue with, doing your hair or cleaning or chopping vegetables? Do you ever notice arm fatigue, or while you're shooting? I know you're a photographer.
Arms, not as much,
Okay.
because I am very upper body with holding cameras. I held my cameras for 6-8 hours a day when I'm shooting. And then I'm typing constantly with my other job, and lifting hay bales. Still have horses, so lifting hay bales and doing things with them, mucking stalls and stuff. So my upper body is a little bit more in shape. But as far as hypersensitivity goes, I can no longer have my blood pressure taken on my upper arm because it hurts so severely. It shoots my blood pressure through the roof. So an ER nurse had shown me years ago how to take blood pressure on the lower arm. And so ever since then, I've requested it down there, and it's so much better.
Oh, good. That's good.
Yeah.
How about fatigue in general? Do you notice overall fatigue since the lipedema has kind of presented itself after menopause?
Yeah. More and more, in part because waking up with leg cramps doesn't allow for sleep. Lots of tossing and turning, and it just makes it a lot harder to sleep. And carrying around this extra weight throughout the day makes it hard to function and get around and move throughout my day-to-day.
That makes sense. How about brain fog? Have you noticed any brain fog?
Yeah, I thought that was associated with sleep, but it could be both, I'm learning. Yeah.
How about tendency to bruise? Do you notice bruises randomly throughout your legs or arms where you're like, how the heck did that happen?
Occasionally, I haven't had as much bruising as what I've seen associated with this diagnosis, but I've had horses kick me and not have bruises show up, but then randomly show up later. So I've just always assumed, because my legs are so thick, it takes a while for the bruising to kind of bleed through. So I haven't noticed quite as much bruising with that.
Okay. What about decreased functional ability? So difficulty with walking, climbing stairs, what kinds of things are difficult for you to do? Yeah,
stairs are definitely difficult. I usually have to hold onto a handrail when we go to the stadiums and stuff. Usually it's one step at a time, one leg at a time to get myself up and down versus the regular walking upstairs like you normally would. Getting up and down, going down on the floor sometimes to play with the dogs or do things down there, stretch, exercise, whatever. Going down, gravity takes over. Getting back up is really challenging, in part because I have knee implants, and that being on those is brutal. You can't be on your knees with that. But getting myself into a position that I can get up off the ground is really, really difficult.
Okay, so cleaning's probably pretty hard too.
I've been to the waist pretty good,
Yeah.
so
That's
I
good.
usually do that or squat down a little bit. But yeah, getting down to do things is tough.
Yeah. If you need me to write a letter that says you can't clean your floors anymore,
Okay.
I can give that to your
All
partner. How about decreased quality of life? So just finding that you hold yourself back or unable to do things that you enjoy.
It's frustrating, but I try not to allow it to restrict me. I'm pretty strong-willed that way. We did a trip to Australia last year and spent 28 days there touring the country, and I was carrying my 15-pound backpack, carry-on limit weight-wise, with my camera bag. And our last night there after being on this tour, and it was a guided tour, after being on the tour for that long, my last night was in Sydney, and I climbed the Sydney Harbor Bridge.
Oh my gosh.
And not having that 15-pound backpack with me, it cruised right up that thing. So that was pretty incredible. But it was also, because I have asthma and the guide had to hold my inhaler, I was like, oh no, I'm going to hold all these people back going up this bridge. So that was mindful of that. And then you have to kind of maneuver up and over and around part of the girders and things. And that was really challenging getting through those.
Right.
But once I was through those and up the little ladder, there's 5 sets of ladders, knowing that I was up there, I think adrenaline kind of took over at that point.
Yeah.
and I cruised up, and I was pretty proud of myself for doing all that. So
Yeah.
I try not to allow anything to hold me back. But reality is it does to some extent.
Yeah. Well, it sounds like you're really fit also with all the...
Underneath there somewhere is a fit person, just swallowed up by all of this.
Right. How about a history of joint issues? You talk about your knee replacements.
Yeah.
When did that happen?
50 and 51.
Okay.
I had bilateral knee replacement with conformist knees because they allowed they weren't like the off-the-shelf ones where you were fixed. They CT your knees and they 3D print knees, so you're replacing it with what you lost. And that was life-changing to be able to do that because I was to the point that I couldn't walk anymore. And really quality of life was really down then. So,
That was after your gastric sleeve, right?
that was after the gastric
And what
sleeve.
did the orthopedic surgeon say to you about knee surgery? Were there concerns about your BMI or?
Yes, absolutely. I had to get my BMI down to, I believe it was 35% is what they wanted. And I had to lose 50 pounds to be able to get to that. And there was no way I could do it functionally because my knees were gone and I couldn't walk to be able to lose that. Diet wasn't going to do it. I couldn't exercise to do it, so I made the decision to do gastric sleeve instead and was able to lose the weight enough to get it down. I still didn't get down to 35. I think I was at 37 or 38, but they went ahead and accepted it.
You lost 80 pounds
Mm-hmm.
trying to get knee surgery.
Mm-hmm.
Yeah. The next question is kind of a list of things that people often try when they have lipedema. And I'm curious to know whether you notice any change in the size of your legs or your arms with these activities. How about elevation? Does that help at all with the leg size or the heaviness?
No, not really. And I recently bought a sleep number bed because I have severe reflux as well. Mm-hmm. And more with the leg swelling, I've been elevating the bed and having to get that up. And I don't really see anything with that other than sometimes my cramping gets a lot worse because of positional, trying to adjust how I'm sitting in the bed.
Right, elevating, but then working on the
Yeah,
positioning.
yeah. And then when I'm editing photos too, sometimes I'll go sit out on my patio and I'll sit in a Adirondack chair and put my feet up on another chair just to get them up and elevated there as well, and don't really see any improvement from that.
Okay. How about nutritional things like diet, exercise? We know that obviously you had a big diet change with your gastric sleeve, but I imagine you tried diets prior to that surgery. What kinds of things did you notice help you lose weight or didn't make a difference?
didn't really see a lot of difference in a lot of things that we tried. We tried cutting carbs. We tried a few different diets, and exercise. We joined a gym. We swam. Trying all of those things. They made a difference in my fitness somewhat, but not in my legs going down.
Okay. And you talk about exercise, and it sounds like you're still really fit. I mean, obviously vacations and doing all the walking, but you work as a photographer and you carry heavy equipment, and then you also have horses. So do you find that you're unable to, that you need to take breaks, or that you're unable to do anything?
I had to stop writing in part because it was difficult to get up in the saddle, and even once I was up in the saddle, being able to sit comfortably up there was almost impossible. When I'm shooting at carriage events, I have to go across fields, and I'm carrying my camera bag, my second shooter's camera bag, umbrellas, chairs, everything, and towing those in a wagon across a field. So I just recently invested in an e-trike with a wagon. So I now have that as a mode of exercise too, and we're trying to do more and more, taking the e-trike out, and my husband and I just going for rides and getting out and exploring more. So
That's great.
when my legs get tired, I have options, but
good.
trying to use it as a form of exercise as well.
Yeah. What about diuretics or a water pill? Do you take, or has anyone ever tried to prescribe that to you, or are you on one?
I'm on hydrochlorothiazide for hypertension.
Okay.
Yeah.
And when you're on that, have you noticed any change in your legs?
No.
Or no? Okay.
And she had upped the dose. My primary doctor had upped the dose recently,
Okay.
and still not noticing a lot of change.
Okay. And you had your gastric sleeve. You lost 80 pounds. Where did you lose all that weight? Did you notice a big amount from your legs, or primarily your stomach?
Mostly upper body. Some from my legs, but not near as much as what I would have liked to have had.
Yeah.
To me that was pretty important. To be nice to be able to put on a pair of pants and not have them not be able to get them up past my thighs, because my thighs are massive.
Mm-hmm.
And it just never happened. Just never changed significantly.
Okay. Well, based on everything that you're kind of describing, it sounds like this is a classic case of lipedema, just given that your leg size is not improved with, exercise or weight loss. You're obviously very fit. You have a family history of same pattern to the size and shape of your body. But if it's okay with you, I'd like to do the physical exam portion for the clinician's guide. So we'll start, I think, with visual inspection, first when you're sitting down, and then I'll have you stand just so I can see your legs and your hips when you're standing.
Okay.
But when we do a physical exam on someone who has lipedema, we're looking to see if there's a symmetrical collection or accumulation of fat. And so I do see that both your arms are the same size and the same shape. If it's okay, I'm gonna go ahead and pull this down.
It's so warm.
I know, I'm sorry. I'll put it back, I promise. Okay. And then bilateral and symmetrical fat accumulation in your legs. How about your hips and your buttocks? Do you also notice that they're a little disproportionate?
Oh, yeah.
Okay, so we'll take a look at that. Disproportion between your upper and your lower body. So your legs are definitely larger than your upper body. We're going to check for any sort of lobules or grains of rice, anything that we can kind of feel. Do you notice any on where do you notice them?
Just right along there.
Right along there.
Yeah.
So I'm just palpating to see if I can feel. These can range in size from grain of rice, to pea size, to walnuts, or even larger. I don't feel any down here on the lower leg. Are they also present on your other thigh, on the right thigh? Yeah, very similar.
Yeah, there's a larger one. Of course, I can never find it when I'm trying to show somebody.
That's okay.
But yeah, there's a larger one that's up in this area too.
Okay. And then how about on the arms? Do you mind if I feel? Okay, perfect.
so much edema in my lower legs right now.
Mm-hmm. I'm just palpating to see if I can feel any sort of nodules. A lot of times patients will already know where their like lumps and bumps are. They're like, this bump here is really painful. Now you have some kind of spider veins or blue veins. Have you had those for a long time?
They've been popping through more and more recently.
Yeah.
And I have
that one
on
there.
the inner thigh. There's some on my legs down by my ankles.
Yeah. Okay, great. We'll just do this part of the exam. I'm looking to see if there's cuffing present. So that's usually where we have a small size wrist. And there's either cuffing present at the wrist, which I do see a small amount here, but really when we get to this elbow is where we see this kind of dramatic increase in size. I'm also checking to see how this feels temperature-wise. A lot of times patients with lipedema will report that their areas where they have a lot of adipose tissue feel much colder to touch than, say, their abdomen or their chest, right? So
when I've noticed when I get cold, it's really hard to get warm again.
Right, big temperature swings, yeah. The other thing that we're looking at on the feet is I like to check for circulation. So any calf cramping or pain when you walk long distances that stop you? I know you get it at night, but
yeah, mostly at night. The walking can be difficult.
So you have good circulation down to your dorsal pedis pulses. I can feel good circulation there. And then what we often check for is something called a stemmer sign, where we're pinching the skin on the top of the foot to see if we can get any sort of a pinch of fluid. I heard you say earlier that sometimes your legs or your feet swell. Is that at the end of the day primarily?
No, it's just kind of random.
Okay. And do you notice it with increased temperature?
Yeah, definitely when it's hot.
Okay. The other thing that I'm going to do is just push here.
Oh yeah.
I'm sorry, I know this is tender.
No, you're fine.
Okay, I'm going to just see if we can get any sort of a
there's usually
indication of edema. We often recommend providers hold pressure for about 10 seconds just so that if there's going to be a fluid shift, it has time to shift.
Okay.
So you don't have a ton of pitting edema, just slight, which can be an indicator of lipedema as well, because it's not really fluid. It's adipose tissue that doesn't have a lot of fluid shifts happening. Let's follow the guidelines. Let's see where we're at. So bilateral symmetrical fat accumulation in the legs, arms, buttock, hips, or abdomen, disproportionate between the upper and lower body, lobules of fat, present of curvature or a cuff. So I do see this right at the ankle, and I do see that right at the elbow. Presence of spider veins or varicosity. So I do see some scattered spider veins and maybe a varicose vein up here. We're palpating for any sort of nodular or fibrotic texture in these areas, whether it feels like rice, peas, or walnut. Pain or tenderness in the areas. Is it painful to touch or push?
That's not too bad. Where most of my pain is
On the
is
thigh
up in
area?
this, up along the IT bands.
And same on the right side, still very tender.
Yeah,
do you have
left
any?
more than right.
Okay. Do you have any pets that jump on you or grandchildren that jump on you?
Yeah, I have dogs. Grandkids are a little past that. They're teenagers now, so not as much.
But your dogs, if they
the
jump
dogs,
on your lap,
Yeah.
is that okay or is it uncomfortable?
No, it's uncomfortable. Yeah, they always seem to put all their weight onto one leg on whatever the most tender part of my leg is.
Yeah, that's about right.
Yeah.
Perfect. And then we're also checking for cutaneous hypothermia, which means, where there are areas of a lot of adipose tissue, often feels colder to touch, and it does in fact feel colder to touch. And then the stemmer sign is a check to see whether there's fluid in the feet, which can indicate advanced lipedema. and a combination of lymphedema. So it does look like you have lipedema because it's hard for me to pinch the skin on the top of your foot. Normally we want to be able to pinch the skin and get tenting like that, and I'm not able to do that because of the fluid on your feet. Absolutely. All right, so I'm going to get you upright in the chair, and then I'll have you stand, and we'll do a quick exam of your legs, okay? So just hang tight. I'm going to make it comfortable for you. Thank you. So what I'm looking for when you're standing here is whether your arms and legs are symmetric and the same size, which I do see, and the same thing with your legs. I also can still see this slight cuffing at your wrist, as well as on the back of the elbow. I'm looking to see, you know, where that is. And then when you straighten your arm, I can see this cuff of adipose tissue. I'm also looking when you stand up, it's easy to see if there are varicose veins. So I'm looking to see if any of your veins are kind of bulging or visible. A lot of times they're not when there's adipose tissue over the muscle like this, but I'm gonna have you turn to the side and just stay there. So what I'm looking for here is whether there's any sort of buttock or hip involvement. And compared to the size of your waist, this is disproportionate, absolutely. Does it make it difficult to sit in any chairs or?
Oh yeah. Yeah, especially, you know, flying airline chairs, they're 17 inches and this is not a 17-inch hind end, or even in doctor's offices, the chairs, they always have the little chairs with the metal armrest. And any pressure that goes against my legs is painful.
Yeah.
I don't know.
So we're just seeing this cuff here is what we're really looking. And then we can also see, you know, that her waist is so tiny, but she's got this disproportionate buttock here. So it makes it difficult to lie flat in bed. It also makes it difficult to sit. And so a lot of times patients will have a lot of low back discomfort, but also finding pants that will fit, you know, her hips and her buttock, but she's got this tinier waist, so it's definitely disproportionate.
First, they have to get up past the calves, and then up past the thighs.
Right.
And then if I can get them big enough for the thighs, I can usually get them over here. And then I've got a big gap.
Right. I'll have you turn again all the way to face the window. And then I'm just checking the back of your legs. And again, you just have some spider veins. I'm just looking for varicose veins. So there's this little spider vein here. And maybe like a little bit of shadowing of some of these bluer veins, but it's hard to tell when there's this much adipose tissue whether there's true varicosities underneath there. And maybe some evidence of venous insufficiency with discoloration.
I also have some sunburn back there
from
the summer.
From the summer, okay.
Just, my capris kind of rode up and I didn't have sunscreen on in that area.
Okay, perfect. And then again back here, I'm just checking temperature-wise to see if this is a different temperature compared to your back, and it's definitely cooler to touch than your core. Absolutely. Okay, well thank you very much. I appreciate that. We'll have you sit back down. So it does look like you have lipedema. There are a bunch of options for you in terms of management. There's non-surgical and there's surgical. In terms of non-surgical options, it's really about managing your symptoms. So we can prescribe compression stockings that are not too tight, because that will cause bruising and discomfort, and compression that's also not so loose. So I always recommend a 20 to 30 millimeter of mercury compression. Ideally, you would get measured and fitted at a supply store, like a medical supply store, because they're gonna measure around your ankle and around your calf and around your thigh. And most patients with lipedema find that when they have some swelling in their feet, this is really helpful to kind of prevent the swelling from happening towards the end of the day, which means we'd want you to get measured and fitted for compression first thing in the morning before you have a lot of swelling. And then you would put the compression on first thing in the morning when you know you're going to do a lot of sitting or a lot of standing. And that will keep some of that fluid from accumulating down in the leg that causes some of that heaviness and fatigue. It's not going to shrink your lipedema. It's not going to resolve it or take you from a stage 3 to a stage 2. But some patients find that because lipedema is a connective tissue disorder, it helps kind of stabilize or support your legs when you're doing a lot of walking or standing. Does that make sense?
Yeah, I've had just the short stockings, ordered online. The problem I have with those is between my height and my body type.
They fold
They
in.
yeah
and
they roll down and they end up here and causing me more pain because I've been trying to use them more when we're driving places, like when I drive down to events in the truck. It takes in Seattle traffic anywhere from 2 to 4 hours to get down to where I'm going, or when we're flying long distances, trying to use them. But as soon as I move, they roll down.
Did you get them at a medical supply store? Or
No.
Did you order them online?
I just ordered them online.
Okay.
Yeah.
So ideally, we'll have a pair that fits.
I didn't even know that existed.
Yeah. So
I mean, I kind of knew about that. I didn't know about you could actually get custom sizes.
And what I always tell patients is I don't necessarily want you to pay out of pocket for a custom compression stocking until you've tried a measured and fitted compression just over the counter. But it's a little different than just shoe size. It's actually measuring like how long is your lower leg or how long is your entire leg. Depending on what you want, some patients just need knee high. Other patients have more discomfort in the thigh, so they want a thigh high. Thigh high is a little tricky because they use a silicone band to hold it up. And a lot of times patients with lipedema, it doesn't cut it, or it'll cause a rash or skin irritation, or it'll fold down or flip while people are wearing
I can
pants.
guarantee it'll do that, yeah.
So-
That's been my luck with anything.
Yeah, so some patients like pantyhose. They feel like a little bit tighter than a yoga pant. And again, it's really just to give you some support. So buy one pair of stockings, and then if you like them, you can always order more from an online vendor that may be a little bit more affordable. But I don't want you to go out and invest in a ton of compression if it doesn't help you or if it doesn't make things feel better. Some patients find compression makes their symptoms worse. Other people say, I can't live without them. And we just don't know where you're going to fall until you've tried the stockings. Don't feel like you have to wear them. Again, it's really just to support you and your symptoms. Okay. I also highly recommend patients get a lymphatic pump when they have a combination of lymphedema and lipedema. I suspect that a lot of your fluid that's happening in your feet and legs is a combination of so much adipose tissue pushing down on your lymphatic channels that you've got fluid backing up in your legs. But I think you also have some varicosities in your legs, some varicose veins, and that can also cause swelling. So compression is the recommended treatment for varicose veins, the recommended treatment for lymphedema, and also helps with lipedema. So it's okay to try them, okay? I don't want you to get anything tighter than 20 to 30 millimeters of mercury because there's a chance it can cut circulation off or irritate your skin. So for now, just stay with that low level, and then we'll check in again to see if you want something a little tighter, okay? We also want you to be able to put them on and take them off without someone helping you, okay? All right.
I kind of figured it out. And I do notice a difference when I do wear the ones that I have. I definitely have, like riding in my truck, driving down, when I get down there, it's hard to get out of the vehicle and walk around to do anything when I don't have them on. So I do notice a difference when I'm wearing them.
Okay, perfect. The lymphatic pumps, there are multiple brands or companies. They are usually going to provide you with someone to help you, like a representative who will help you get insurance authorization. So I'll give you the referral for a pump. You can use it twice a day. You can use it in the evenings. We want you to use it on days that you're not getting manual lymphatic drainage, and I'll explain what that is in a minute. But that pump can be covered by insurance if you reach the requirements that your insurance has set up. And every insurance is very different, so I can't tell you exactly what that looks like. But I do have some kind of general guidelines that I'll provide you. And then when you reach out to the vendor with the compression pump, you'll want to ask two questions. One, do you take my insurance? And two, can you help me get insurance to cover this? And then I'll work with you or your primary care doctor can work with you locally that can help you fill out any sort of forms or paperwork that they need. Usually it's measurements. They want to know whether your legs are improving if you use something like a basic pump. And we don't usually recommend basic pumps for long-term use because they don't really help move the lymphatics as well, okay? And so then when you're not using that pump, Ideally, we'll get you in with someone who's trained in manual lymphatic drainage,
Okay.
which basically means we can touch the top surface of your skin very gently, almost like a brush-like stroke, to move the lymphatics up and out of the legs and maybe even out of the torso and the hip area.
Okay.
It's considered manual lymphatic drainage or complete decongestive therapy. And most therapists are occupational therapists, physical therapists, or massage therapists. Those are the ones that are certified to perform that.
Okay.
Some of them take insurance and some of them do not.
I do have a referral for a provider in Anacortes that the physical therapy office at the hospital there
That does
that hopefully I can get it approved
Yeah.
through insurance. The referral is out to insurance right now.
Oh, that's great. Okay, perfect. And because we're working together, if you need help with any other documents or forms or an appeal to the insurance about that,
Okay.
just let me know and I'll help you with that, okay? So that's great. So when you're not doing manual lymphatic drainage with your therapist, they're going to show you how to do some of these brushing activities or massaging activities to help when you're home in the evenings or first thing in the morning, whatever works best for you. And then you also have the pump that you can use. A lot of patients take it when they travel. So after a long flight, road trip, they want to get to their hotel and put their pumps on so that they don't have a lot of heaviness and discomfort for their next adventure
Okay.
when they're on vacation, okay? So we've talked about manual lymphatic drainage, we've talked about compression, we've talked about the pump. There are some nutrition changes that we may ask for you to try, such as low sugar, more of a keto diet, lots of protein, low anti-inflammatory diets will sometimes help. Some patients who haven't had a gastric sleeve or had a lot of weight loss benefit from adding in a GLP medication. A lot of patients now are using a medication called tirzepatide, and many are using it on a microdose level, meaning they're just using a little bit of it to help with inflammation and pain and tenderness to touch. So a lot of patients with lipedema say, my arms are so tender to touch, or my legs hurt to sit in chairs or to push down on them. And they're finding that this medication kind of takes that pain and discomfort away. They're not trying to lose a lot of weight. We know
So that's one of the weight loss medications. Is it like a GLP-1?
A GLP-1, yep, or a GLP-1 plus. And so while some people use it for weight loss, we know that no matter how much weight you lose, your adipose tissue is not going to reduce. So patients are using it to help with maybe some excess fat that they may have in their abdomen or their torso, because you can be overweight and you can be obese and have lipedema. But for you, you've had the gastric sleeve, you've lost all this weight, but you're still reporting this inflammation and this tenderness. So sometimes microdosing a GLP can help with that, okay?
Is there side effects with that?
There are minimal side effects if you do it safely and correctly. So I don't like patients who are getting compounded medications from a pharmacy that's somewhere in the country by a doctor that's somewhere in the country that they've never met. And so there are some guidelines that we'll give you if you decide that you want to try a GLP that you can read ahead of time, look over. But a lot of these adjustments that we have you make, meaning eating small, regular amounts of food, focusing on protein, we still want you to eat carbohydrates, being really well hydrated, getting enough fiber. Those behaviors and changes will prevent you from having side effects from the medication. And we really don't like you to increase the medication if you're not getting good nutrition or if you're having side effects, where a lot of times patients just up their dose without really considering, should I up my dose or why would I up my dose? And so we help guide patients through that process when they're on that medication. It's not required, it's not going to cure lipedema, but it's something that you have in this toolkit of things that might help your symptoms. Does that make sense? Okay. So then there's that, the nutrition. The other option that you have is surgery. So if you've tried all these things, you're physically fit and you exercise and you've had gastric sleeve and you're changing your diet and you're using MLD and you do compression and you use this pump, if you're still having discomfort or mobility impairment and otherwise very healthy, your blood pressure is under control, those types of things, then you would be a good candidate for plastic surgery consultation to discuss liposuction. And there's a couple of different methods that they use. I never recommend one surgeon over another for various reasons. I think it's a very personal decision who you're going to work with. But I do give you some guidelines on questions that you should ask. You know, how much experience do you have? Can I see your before and after pictures? What's the support that you offer? What do you do for monitoring patients before surgery and after surgery? Where would the surgery happen? Would it be in your office, or would it be in an operating room at a hospital? How much fluid can you take? Or how much adipose tissue can you take? How much fat? Do you take it just based on what you see, or do you do the entire arm or the entire leg? Do you break it up in sections? Do you just do my lower legs first, and then would you do my thighs? When would you do my arms? Those types of questions, right? And then you also want to ask, what's the recovery like? So will I be in compression? Do you offer a therapy or a nurse to come home with me? All those types of things to make sure that you're safe if you decide to go forward with surgery. We do know that there are insurance plans that will cover liposuction for lipedema. They do have diagnosis codes that will work, and they also will give you kind of guidelines if you ask them, you know, when would you cover this surgery? There are also companies that will advocate for you, attorneys or social workers that have been known to help patients get this approved, and so you can also reach out to them for additional help. But most plastic surgeons who help patients with lipedema provide someone in their office to help get prior authorization, and so they should be able to help you with that. I also have patients that go out of the country because in Europe, they do have
cheaper.
It's recognized in Europe. They have ICD-11 codes, and there is a diagnosis code for lipedema over there. But in the United States, we're still using ICD-10 codes, and there isn't quite a code yet for lipedema. That also makes it really hard for us to track how many people have it and what are the complications that come with it, because we just don't have a code to know how common is this. If you decide to do surgery out of the country, it's not covered by insurance. And so there's a lot of nuances and things that you need to consider. With that being said, I always recommend people join support groups online so you can ask these really specific questions. So there's one in the Pacific Northwest, but you'll find them all over, and you'll see a lot of people who post blogs before their surgeries, after their surgeries, and so you can really kind of learn a lot by reaching out to a community that's been through this, right? It's a lot of information. How are you feeling?
It's a lot. I'm glad to confirm what I kind of already knew. Options out there are hopeful and discouraging at the same time, to know how little is out there to support helping get rid of this and to reduce it. There's got to be, is there research going on out there?
All the time, yeah.
So there is people out there trying to figure it out. So.
I think the big thing I want most of my patients to know is that this is not your fault. This is not because of your inability to diet or exercise appropriately, that this isn't something that reflects laziness, as most patients are told over and over again growing up, like stop eating so much or exercise more, but this is really something that's genetic, and it's out of your control, or at least it was until now. And then hopefully now we've given you some tools and some things that you can focus on to get some symptom relief, right? Surgery is never required, so I don't want you to think that it is required, or should I do it, or when should I do it. It's a really personal decision. Some patients find that doing surgery early on in an early diagnosis of lipedema requires less invasiveness or less skin that's kind of left over after liposuction. I think it's hard to know kind of what your surgical options are, so I always recommend doing lots of consultations. And some surgeons will meet virtually, so you can at least meet with someone and ask these kinds of questions, and you'll know, do they perform this in the operating room or in their clinic? And no, I only want to see a plastic surgeon, or I only want to see somebody who treats tons and tons of lipedema patients, that their degree isn't as important as their experience. You know, there's all these kind of specifics that you'll want to know?
So my husband is still somewhat on the fence about this. I feel like he is. I mean, he's listened to me, but prior to this, he's been, well, you just need to lose the weight. And, you know, I tried that, and it still didn't happen. You know, we want to diet, we want to exercise, we both need to lose weight. But looking down the road, if I do decide that I want to do surgery, his biggest concern is, well, it's just going to come back. And so what do I say to that? I mean, it's not going to go away, but does it come right back if I don't diet and exercise and do all these things? Or in spite of it, since it's something that comes on anyway because of genetics, once it's removed, are there new cells that move in? How quickly?
Yeah, that's a really great question. Yes. So I think that's why it's important to see a plastic surgeon that really understands what lipedema is and how it's not necessarily about more fat cells, but it's the fat cells themselves getting larger.
Right.
And so ideally, or at least what we understand about lipedema, I feel like the information changes so much that, you know, what we know now is that it has to do with larger adipose cells. And so ideally you want a plastic surgeon that does a really comprehensive surgery that removes as much of the fat cells as possible, so that should you have any sort of hormone shifts in your life, those other cells that are maybe not as large or causing any sort of bulging areas, they don't become larger in size. So you really want a surgeon who understands how to do a thorough procedure, but also do that safely. There are some patients who do get rebound or return of adipose tissue initially after surgery. But most patients who undergo liposuction for lipedema have improved mobility, and they have kind of less. They don't need as intense of compression, or they don't need as much MLD, or they don't need as many anti-inflammatory foods. It's just less painful. So while lipedema will never go away completely, and we cannot cure it at this time, we can do things that mitigate those pain sensations or discomfort that you're feeling. Most patients will find that they may need a repeat surgery, but not everywhere, right? So there may be an area that needs a repeat surgery, but again, that really comes to you having a really good conversation with your plastic surgeon and asking that question. How many of your patients have to have this done twice or 3 times? How do you guarantee that I won't if you're guaranteeing this, right?
Yeah, because if you have to pay out of pocket, even if insurance does cover it, they're not going to cover 100% because nobody's contracted with the insurance companies to pay it that way. Yeah. It's not something that you want to pay for twice.
Right, exactly.
And
I mean, just from a health standpoint too, you don't want to have surgery more than necessary.
Yeah, but just to be functional, to be able to sit in a chair comfortably, to be able to do so many things that are really tough to do as bad as I want to do them now.
Right.
Yeah, it'd be nice to have that freedom.
Yeah, absolutely. The other thing I'll let you know is that even though you have varicose veins in your legs, or what we suspect looks like indication of venous insufficiency, you don't need to treat varicose veins with a vein surgery. It may help some of your symptoms or some of your swelling, but it's not necessary. And insurance companies will tell you, as long as you're wearing compression stockings, there is no need to do a vein procedure. So I also don't want you to necessarily get worried or stuck on that. Having varicose veins doesn't indicate that you have a higher risk of heart attack or stroke or blood clots or things like that. They're usually also genetic. So unfortunately, you've got the two that are passed on amongst families. So.
Hey, I skipped the diabetes, so there's that.
There you go. Most patients with lipedema are actually very healthy. They don't have a lot of issues with cholesterol and high blood pressure or diabetes. While most doctors will look at the BMI number, we actually ask physicians to consider you as a whole entire person, and if they can just look over the BMI number, understand that you have a condition called lipedema. And I'll also provide you a letter so that you can take that to medical offices if you ever have any other joint issues that will say, hey, you have lipedema, it's a condition known to cause joint issues. We'd like you to consider how healthy you are rather than look at this BMI number and just flat out say, I won't operate.
Well, even getting TRICARE Prime to cover as a secondary insurance, or for some patients, a primary insurance, but requiring that a BMI be 30 or less.
Right.
Is impossible with this condition.
Impossible, yeah.
And that's not fair.
No.
We're going to cover it, but only if you're completely healthy.
Yeah, yeah. And again, you know, now that we're working together, if you need help with any sort of an insurance appeal for any of this, you just let me know, okay? Any other questions? It's a lot. I'm going to send all this to you in writing.
That's good.
So you'll have time to look over it. I'll give you copies of all your referrals. You'll be able to schedule follow-ups with me anytime something comes up. You just get online, book a virtual call so you don't have to drive down here. Keep your feet up at home. We'll have a nice conversation. Is there anything else I can do for you or any other questions?
Not that I can think of.
Okay. You feel better about this?
Yeah.
Slightly?
Yeah, I mean, it's like I said, it's a relief to know that this isn't just fat.
Right.
I'm not just fat. The hard part is other people see you as that's what they see, and you can't go, no, I'm not fat, I have a condition. They just see that, they see the legs. So I've gotten to the point in my life where I don't care as much. So I wear the capris, I wear the shorts, I wear the tank tops and do what I want to do, but I know not everybody's like that. There's a lot of people that are so self-conscious about this, so it's tough for them.
Yeah. Well, I really appreciate you doing this.
You're welcome.
I hope we can, change the opinion of people, one person at a time by educating them on what this is.
Providers.